So Max, you've been having problems with shoulder and neck. What would you like to focus on today?
Yeah, well, shoulders, both shoulders actually, Steve.
Mm-hmm.
And it's not because I've been training hard and working hard at the gym or whatnot, and I've been doing my yoga to try to help my shoulders with movement. But what I've noticed is because probably 8+ hours a day at a computer. So I'm at a computer like this for 8+ hours a day, and probably the tension. So that could explain why both shoulders. So I find that eventually at night or whatnot, if I try to lift my shoulders, I can lift my shoulder up to here.
Mm-hmm.
Once I start going higher, so I'm guessing the shoulder, the deltoid probably is hurting all the time in both arms actually.
So are you getting any pins and needles or any numbness, pain all the way into the fingers, into the forearm?
No pains and needles to the forearm.
Yep.
Or wrists or fingers, which is good, I guess. But just soreness, bit of aches. You know, if I sleep at night, I might be sleeping, and when I wake up in the morning, just moving my shoulders.
Mm-hmm. What about driving the car? Have you noticed after driving the car, you start to get uncomfortable and you have to move the shoulders, and it doesn't feel right?
I think for me, if I keep my shoulders down, I'm okay,
mm-hmm.
because I do a bit of boxing as well,
mm-hmm.
and I'm okay if I'm below the shoulders.
Mm-hmm.
Even on my computer, I seem to be okay, but as soon as, for example, volleyball, as we play volleyball,
Mm-hmm.
or tennis, it's just very difficult.
Okay, any problems turning your neck or pain in the neck or headache?
No, that I'm good, and hopefully my yoga has been helping with that.
Yep.
But no, that's quite fine actually. I'm very worried and mindful about posture. Obviously, you've always mentioned that to me.
Sure.
Stay straight, so I'm mindful of that.
Okay, so what we'll do is we'll lie down, we'll have a look at the arm and neck, see how they're both moving. I'll come round behind
Mm-hmm.
and just have a feel to see if there's any worrisome parts to your body there. So I want you to sit there for me.
Okay.
And what we're just going to do is, you've shown the shoulder movements, you've shown neck movements. What I'll do is we'll just palpate the neck itself. A lot of these muscles in the front of the neck tend to shorten and have a large effect on what's happening in the base of the skull, which will then affect what's happening through the skull here. So all these fascial connection points, muscle attachment points will be affected. The nerves can be affected, which can cause pain and headache. But with the actual shoulders themselves, when you're on a computer for that length of time, sometimes you're not sure or aware of how you're sitting. You start to develop these areas in the front shoulder, front chest, front neck, and the side, which can create this sort of tension and pain. So any movement above the horizontal is really accentuating what these muscles are doing, and basically they don't like it. They've had enough, they're tired, they're fatigued, they need something such as acupuncture, myofascial release, to get the shoulder working properly without that pain. And you know, we can palpate in these areas just here, and especially in the large pectoral muscle here, and then into the arm. So all these muscles, front muscle, biceps, coraco, front deltoid, side, back deltoid, pec minor, pec major, forearm will all be affected. Yeah? So it's all a continuum. So when we're at a computer, this is a continuum from the fingers through the elbow, into the shoulder, into the neck. And after a while, it builds up and it becomes uncomfortable. And then you can affect your work, fatigue, stress, anxiety, and you get very sore and you start taking medication, which is what we want to try and avoid. That's the easy way out. Best solution is you have it checked, have it worked on. We do some acupuncture and myofascial release the neck and head, so we can go from there. So why don't you any questions before?
No, but that's interesting. What just you now touching certain spots? I'm assuming those are trigger points that you touched.
Sure.
Because as you touched me, different places here, on the shoulder, on the pec, I could feel just with the light touch already. It was a bit sensitive, and I have been rolling, so using a ball. So I've been doing that as well just to massage. So I've been taking care of it. But what you're saying is that you still perhaps need extra work, fascia work and acupuncture. Is that right?
Well, the fascia is quite deep and actually supports the muscle and attaches to the bone. So without fascia, muscle has no strength and power and shape. The fascia actually binds it all together and allows you to put the arm or the neck or the body in the right place and give it structure. Mm-hmm. If the fascia is tight, the muscle's tight, therefore the shoulder can be affected, the neck can be affected. So all these movements that you want, they're compromised. So when that's released, you get blood flow, you get chi circulation, which is very important with acupuncture. Yeah, and you start to feel alive. So we're working on the central nervous system, musculoskeletal system, internal organs by combining all these techniques. So
energy.
It's energy, flow of energy. If you don't have flow of energy, we've got restriction, pain, which then leads to the obvious anxiety, tension, addiction to drugs, pain medication, anti-inflammatories, antidepressants, and we want to avoid that.
And I guess the breath as well, breathing, is such an important part.
Well, if you think about the upper ribs here, the upper ribs are very important because they're the ribs, they're attached to the neck. The first and second rib attached directly to the neck. So if it's shortened through here, it'll stop the ribs from rising and falling the way they should. Once they're released, you get this length back in through the neck and the shoulder. You can stand up straight, and that's why yoga is very important. Because when we're standing in certain positions, we're opening up the chest instead of collapsing forward, which is...
That's what we do.
That's what we do when sitting.
Sitting at our computer, driving if you're driving, or if you're commuting, you're reading a book, or if you're looking at your screen.
Oh, the screen's the big one. The screen, the laptop, the iPhone, whatever it might be, that's our position. So, you know, we're hitting everything at once.
Great.
So why don't you lie down?
Sure. Facing down, facing up.
Facing up. And what we'll do is we'll just slowly see what we like to do is think of this as a continuum. So we're not just working the shoulder is attached to the pelvis through the abdomen, the rib cage, the neck, the clavicle. So I actually start by palpating in through the rib cage and chest. So we're comparing right and left, and we're also comparing right and left side body as well, because the side body is attached to the shoulder as well at a very deep level. So by looking at these areas through the pectoralis muscle, coming across front deltoid muscle, straight away we can identify what's going on in the body, and straight away there's all these areas of stuck chi.
I can feel that just like this.
And we run down the arm through into the bicep. We can go inside to the smaller muscle coming off the shoulder blade. We can go outside. This area here is almost like our ITB. Okay? So it's connecting the shoulder, elbow, arm. So this is your sort of lateral ITB, which when you think about it, can get very restricted. Attaching into the elbow, you look at the forearm, and you can feel straight away there's all these restricted areas in the forearm. The flexors, the extensors, bicep, deltoid, pec minor, which is quite deep, pec major, we've got two heads, we've got coming off the sternum, coming off the clavicle, internally rotates, shortens when we take the arm across the body. So we're going to look at opening up in this direction, both sides of the body, and that's just the shoulder. When we get to the elbow is usually flexed, so we're going to take the elbow and wrist and take it into external rotation. And with the breath, when I start working, we start using the breath and we start to open up. So I really haven't started treating, I'm just examining, but getting a feel for what's going on. But we're making changes already by doing this. So you're aware of your breath, you're aware of me working on your body, and we work into the wrist and thumb. The thumb is a connection through the forearm right up into the neck. So if we've got neck problems and thumb problems and elbow problems, we get right into this point, into the thumb here. And we also like to work into the wrist, which is a very mobile part of the body, which connects the sort of elbow and wrist and hand. So the more work we do in through this area of the wrist, it allows the hand to open up. And then we get into the fingers as well. So anyone who's working on a computer, in an office, long time in the office, this area here is vital to relieve tension. which will have a knock-on effect up into the neck. So we can just do nice, easy examination, treatment at the same time. We can come into the shoulder, open up the shoulder. We can also use a technique called muscle energy, where I get the patient to push into my hand with their wrist. So we're actually working the body and relax without actually doing too much work. We get the patient to do a lot of the work. We can change angles so we can get deep into the pectoralis muscle. I'm working with Max's breath. He's breathing in, breathing out. We're just opening up the rib cage. And why do we do that? Because the rib cage is very important for the breath. If we're slumped and round, it's shortening the rib cage, it's shortening the ability for the breath to become full, opening up the chest, which once again has an effect on lower ribs, abdomen, neck, front, shoulder. So it's all very gentle. You can feel just in this area here. So this is the left shoulder. There's a great reaction happening here while I'm working. You probably can't see it, but there's a great reaction just in this lower part of the pec muscle. It's flicking away, and that will have a huge effect on what's happening in the front shoulder.
It's interesting on how everything connects, isn't it?
Yeah. It's all done very gently and without too much force. I mean, I've got to think of myself too. When you've been around as long as I have, the less work you do, the better. You're still working, but you're working smart. Not putting too much effort into it. So in one muscle group here, I can find 30 or 40 or 50 active trigger points, which you could release, which would have a huge effect on what's going on with the shoulder. We get into the side arm, down by the elbow, that tightens up there. We can get into the forearm muscles, and we can work on the forearm flexors, so we can release those. We can come down in through the retinaculum in between both bones and open up both bones. We get down to the wrist. We open up the wrist. It's all that opening. Whether it's a rib cage, whether it's neck, whether it's wrist, whether it's hand, it's all about opening it up.
And this is what we hear. Sometimes we hear the carpal tunnel syndrome.
Yep.
And that can be the wrists, right?
Sure. Yeah. So with Max, there's a huge difference left and right, for whatever reason, into that posterior aspect of his neck and also the lateral aspect of his neck. So these long muscles that come off the thoracic spine and rib cage attaching into the neck are quite tight. So very simply, instead of just pounding away, we can take the neck into a nice position here, get Max to push into the left, into my hand to the left, and let it relax, and we get a nice stretch in through the neck. Push again, and relax, and straight away we get this immediate change from tight fibrous band to a more relaxed state of muscle tissue. And we can do the same with the right. So we've got this body lying down this table. We've got so much space to work, and we don't have to work too hard. We just do it nice and gently with the breath, which is the beauty of the work. We can take the head in all these different positions, work the neck. And a lot of people get a bit afraid about adjustments, but we don't have to always do adjustments. We can just articulate the joints, take them into a nice space, get under the head, release the suboccipital area, which this is probably one of the most favourite areas for anyone to work, because you've got access, you've got tension, you've got blockage, it can affect the eyes, it can affect the jaw, cause headaches, prime area for causing headaches. We can work all the way along the base of the skull, nice and gently, taking the head up into a bit of flexion if we need to. We can side bend, and then from there we can work right up into the scalp. So this is a continuum again. We go right up over the top of the eyes. A lot of people tense up. So we release the top of the eyebrows, which is a continuation of this posterior line of fascia. And And then we can work into the jaw. So what I might do is just use a couple of acupuncture needles for the shoulders and arms. So I'll just do a couple of points while you're lying there. So what we're doing here is we're going to go into trigger points, into areas of tissue that are stuck. From the Chinese medicine point of view, this is called stagnation or blockage. And these are major areas of the shoulder that usually get very restricted, and we can feel these. Just take a breath in, out. So we're going into the fibre, the muscle fibre, and you can go in quite deep with this type of acupuncture. It's designed to get deep into the tissue and release the tissue. Not just one area, but it's affecting the whole meridian, which is a channel of energy running from the arm, forearm, shoulder into the neck. And once again, we can palpate these areas in the forearm. Breathe in, out.
And I can already feel.
So what are you feeling right now? What's the sensation?
The one, especially near the elbow,
Yeah.
seemed to have given me a release right away.
Mm.
Some kind of release, initial release.
Yeah.
Same with this one.
This point I'm using now is called Hegu. It's a colon channel which runs right up, front shoulder, neck, crosses under the nose. So it's a very good point for the head. It's a fantastic point for shoulders. It's also a very good point for any thumb problems. So classically, if you've got someone sitting at a computer all day, they could complain of wrist pain, elbow pain, shoulder pain, neck pain. So therefore, you're going to use the channels that affect the whole length of that meridian. Yeah? That's only one meridian. Then we can work on the other ones which look after the posterior part of the arm and shoulder, or the inside arm as well. But we'll stick with this. I'll do another point up in the deltoid. You were complaining of shoulder pain.
So the one you're treating right now, as opposed to the posterior one, this is how we're always flexing forward.
Sure. This is the one that shuts down or closes, and it closes our chest, it closes our neck. And can you imagine when you're going to bed? When you go to bed, you're still tight. You wake up tight. If you don't do your yoga, your stretching, you look after your body, this tension builds up and builds up over time. So after a few weeks, a few months, a few years, you get to a stage where the whole body is stuck. So we're unsticking. When you're stuck like this, pain can lead to all sorts of problems. We don't work as well, we don't think as well. We lose energy, we're losing time, we get angry. If we're in pain, we get angry. So this is a nice way. Touch is a fantastic thing. When you're touching using acupuncture as well, and explain to patients what you're doing, why you're doing it, the benefits, and it works. Chinese have been using it for 2,000 years and they know what they're doing. They have no hesitation in using acupuncture. It's just the way they treat.
So as opposed to medicine?
Well, yeah. Why give a painkiller when you can relieve pain by acupuncture? Obviously, there are times when you would use medication. Obviously, we're not saying don't use medication, but in a lot of instances, when you come and see a practitioner who can use acupuncture and release the body, you can get rid of pain by acupuncture.
Because the body is so powerful at healing itself, isn't it?
If you're allowed to heal, it will heal. If you take away blockages, and just remember these points affect internal organs. So they're linked to the inside of the body. When you work on the back, a lot of the points along the spine are linked to the internal organs. So if someone comes in with abdominal pain, or they've had kidney problems, or they've got problems with their adrenal glands, which is a lot of people, they're stressed. The muscles around the adrenal glands that sort of are connected to the adrenals through the nervous system, you release the muscle, has a somatovisceral effect. You release the muscle, the viscera, the organs inside can relax and function properly.
I think you mentioned a really good keyword here, the word stress.
Stress.
So stress can cause, Steve, you must be treating a lot of people that come here because of stress?
Yeah, well, I mean, how do you define stress? Stress to me is a change, an alteration in your lifestyle that then has an impact on your body, and you're not aware of it happening until a catastrophic event, heart attack, stroke, asthma, panic attacks, anxiety, you start losing sleep. All these factors are due to stress. Could affect internal organs. We're rushing our food. We don't take time to eat. We don't take time to relax. We don't take time out. So the whole body is almost shutting down and it's stressed. So what do we do about that? Look at the body and start and people come in with back pain and chest pain and headaches and a sore neck, and there's also emotional stress, because we're trying to keep up with everybody. We're trying to drive the best car, dress, say the right things all the time, keep up with the Joneses all the time. But that's fine, but you can do that, but you have to do it in a balanced way. You still have to take time out to look after yourself.
And this is where I guess mindfulness is quite, it's getting to be more and more known about how to be a bit more mindful, how to be a bit more present.
Sure. And the first thing you should look at is, okay, we've got a certain amount of time per day, per week, per month, per year, but you've got to allow yourself through these techniques to say, if it's 1 hour a day or half an hour a day, I'm taking a half an hour off to go for a swim. I might take a half an hour a day, which isn't much, to sit down and read a book. And then once you get used to that technique, I might do it tomorrow. I might get up a bit earlier, get up at 5:30 or 6, which you can do. Have half an hour, go for a swim. Come home and it refreshes you because you've done something different. You're looking after yourself.
So have time for yourself, that's what you're saying. And you're a good example, Steve, because you've always understood the balance, and you've been doing it for years, and you will keep on doing it. Is that right? Going to the beach or coffee or relaxing.
Well, to me, I understand a lot about the body, the mind, the spirit, because I do voice dialogue, I do acupuncture, osteopathy, myofascial release. I understand people to a degree, and I can help them, and you start to listen to what they're really saying, what they want to know, what they want to hear, and you help them. It's like you guide them, you actually manage their health, and you give them time and you listen, which is very important nowadays. A lot of people don't get that.
Another key word you just said is listen.
Yeah, 2 ears, 1 mouth.
So what's happening now? What are you?
Okay, I'm back on the neck because we're not putting a needle in the neck. I'm just going to use a nice release technique. As you breathe and just release this muscle on the left. I'm going to do both sides. So we're releasing some long, tight muscles that run from the rib cage, the spine up into the neck, and these are postural muscles that affect neck movement and rib movement as well. So by working here, we're actually allowing the ribs to release below that, but also we're allowing the neck to release above this. The body is quite complex, but when you understand it, you can sort of see what's going on, and the shorter muscles, the longer muscles, the intermediate muscles all play a role in how we sit, how we stand, how we feel. So the more work we do on a general level, especially around the neck and shoulders, it can have a dramatic effect on who we are, how we feel, how we work, how we sleep, which sleep is another important component. Some people toss and turn, they think it's the mattress, they think it's the pillow, but I tell them it's the body on the pillow. It's the body on the mattress. You can go and buy 10 pillows, but I'll guarantee you, unless you fix the body, it doesn't matter what pillow you buy, it won't work.
And I guess that's a very good example, because I think we're always trying to catch the problem, as opposed to getting to the source of the problem, because it seems to be quicker or easier.
It is. We can go online, we can order a pillow. Doesn't work, we'll go online, get another pillow. Let's get to the source of the problem, let's get to the real issues and deal with that.
And that is awareness, as you just said. We just got to slow down to be aware of what's happening in our body, in our mind. Otherwise, we're just rushing by.
We rush by, we don't, before you know it, you're retiring. So, and my theory is you want to retire, whatever retirement is, in a good state. Don't worry about numbers, don't worry about 50, don't worry about 60, or don't worry about 40. Just get on with it. 50 and 40, there's not much difference. if you start to understand the balance, what's necessary with balanced lifestyle, it'll make a huge difference to your life, and then you just enjoy life. And and the beauty of it is you can actually then pass on that information to other people, which is what it's all about. So we're just back on the base of the skull, working the base of the skull. Every time we go back to this area, it gets softer and softer because you're allowing blood flow, you're allowing oxygen, you're allowing the metabolites to release. And the body is not upright, so by lying down, the body all of a sudden can have a break. It doesn't have to support itself. Muscles can relax. There's no sort of gravity affecting our body, which is a big influence on how we stand and how the rib cage sits and how the head sits. So it's just a nice, easy technique to release the upper part of the body.
And talking about yoga, I started doing yoga because of, I think it was about nine plus years ago when you suggested I started doing yoga as part of my activities to help my body, actually my mind and my body.
Yep.
So you still recommend your patients to do yoga, and is it a certain age that we should start, or what's happening with the theory on when and the why?
Well, my theory is kids should be starting yoga as soon as possible. My theory is kids should be learning yoga from a very early age. Let's say first year at school, the schools implement a program. Someone comes in, they pick the kids, they say, right, Monday morning, 7:30, we'll do half an hour of sitting there, we'll do some basic stretching. Get them introduced to just sitting there and doing nothing in a group. Fascinating. But I'll guarantee there'll always be problems, but the problems you can solve. There'll always be a few fidgety people, there'll be some that like to sit down and be quiet, but that's fine, you can work with that. Once they understand the process, and after a few weeks they'll start to appreciate what we're trying to achieve, they enjoy it. Yeah? So they'll be looking, they might even go home instead of being on the computer, they might go home, I might meditate, or I might do half an hour of yoga, I might stretch, which for me would be a killer, absolute killer.
And I think it's happening in the US. They're starting to realize they're introducing yoga, mindfulness and whatnot in school at an early age. So there's the woo. I really felt that was
that was a woo.
It's interesting on how just the feeling of release.
Well, see, this could be, if you think about the corporate world, I mean, I go into boardrooms and the boardrooms are empty a lot of the time. So I take my table into a boardroom and I'll get some people who have been sitting at a computer for 15 minutes and I'll lie them down and do exactly this, do some acupuncture points, take them out, and then you'll monitor how they felt through the day. And you'll go in a few times and do the same thing. Guarantee you they'll be a different person. They'll be more relaxed, more effective, they'll feel freer, they'll sleep better. And it's just this, getting them to understand how the body works. It doesn't like being cramped and stressed and doing too much. You can still work hard, but it's also about working smart.
I like that. Work smarter, not harder.
Yeah. And then what I do is I'll get people to work in pairs in the corporate world. So I'll get them to, ooh,
nice. Ooh.
If only you could see this.
I think there's some fireworks. There's definitely something going in, and that's just from one.
That's one needle.
One needle. So usually there's no minimum or maximum. It's all about pressure points. It's all about
trigger points.
Trigger points. Sorry. Yeah.
They call it Shi points in Chinese, but trigger points. These are points that are, in a non-technical term, stuck.
Okay.
So they're parts of the central nervous system. They're in the muscle themselves, but they're parts of the central nervous system that send feedback to the brain.
Yes.
So if they're sending feedback of restriction, the brain goes, oh, you're restricted, that's okay, you're stuck. That's the way it is. You break the cycle, the pain cycle, and the information going back to the brain. The brain then goes, oh, that feels better. Releases serotonin, the nice chemicals, it relaxes, the muscle goes, oh, thank heavens, I'm home. So you've only worked one part of the muscle, but it's a huge part of the body.
This one's interesting, Steve, this one that you just put in, because I've been rolling my tennis ball against the wall, and that place has been so sensitive, and now just with the needle in, it's just seems like a big release.
Well, that's what happens. It's a reaction. The message goes back to the brain. The needle's in there. The brain goes, wow, relax. And it does. The muscle goes into this state, and then it just goes, oh, thank you for that. All of a sudden, the muscle can just relax. So that point there won't be as tender. You then should have a better range of movement.
Wow.
So you take the arm up, and this muscle here is obviously a prime mover for the arm going up. You get to a certain point, the muscle fatigues much quicker and shortens and doesn't like doing that. So it goes, oh, this isn't much fun. I can't do that, so you won't do it. Now when you take the restriction away, they go, let's not do that. But it takes a few treatments.
I was going to ask, there's no magic pill?
No magic pill.
And in this as well, so it's just working trigger point by trigger point and eventually to release the different areas and continue maintaining.
Yeah, so you might work the shoulder and forearm, one treatment, and neck. Then you might do the front forearm. Then you might do the inside forearm. Okay, you're not going to try and do the whole body at once. Then you might roll over, obviously, and then do hips. Because the hips are obviously weight-bearing movement, sitting, getting up from sitting, the way we turn, getting out of the car, carrying bags. So the hips are going to be involved. Hips, hamstrings, quads, ITB, front hip. So you can pick all these points. I mean, I can find points in the hips here and you can feel it straight away. There's one there, yeah? Yeah. If that was needled, same with the ITB, same with your quads, you can go into the feet and work the feet. That's the beauty of it, hands and feet. That's where the chi actually changes from yin to yang. So the hands and feet are very important for this continuum of energy from a Chinese medicine point of view.
And that's another big discussion, and that'll probably be another session which will be focusing on the hips and hamstrings.
Let's do that.
Yes, because the hips and hamstrings, the sitting that we do affects us, and obviously the hips are, a center of gravity, basically.
Yeah.
And that is so important. So that will be another discussion.
Watch this space.
Watch this space.
But it's the sitting that's the getting up from sitting, and the twisting as we're getting out of sitting. So that if we get out of the chair the same way every time, which is what some people do, i.e. KP, getting up, go to the right. I get up again, I go to the right. So you're always rotating on one hip, which can cause stress. So then you teach the person to maybe rotate the other way. Set a little video, post-it notes, get out to the left, get out to the right. Oh, I'll get out to the left next time. So you're balancing that load. So you get out and then move. You don't get out and move at the same time. Then you get back in the chair the same way, which is stressing the sacroiliac joints, the hips, so on and so forth.
So another key point here, or key word, is balance. Balance, awareness.
In balance.
Movements.
And moving upright. Don't move that way. So learning how to move and walk in an upright way. When you turn, you use your feet. You don't have to. There's ways of turning. There's ways of standing. When you do stand, I get people in a workspace to put one leg up if they're on the phone and do a hamstring stretch. You can still talk while you're stretching. Next time you have a phone call, do a lunge. What are you talking about? There's ways around. And they have fun. Bit of background music there.
There you go.
On cue. So I'll take these needles out.
Mm-hmm. I really feel the... So how far apart can you get acupuncture? Meaning, if you're treating someone for certain, you mentioned that you would treat different trigger points, but if you're working on a certain area, how much time do you have to wait before you can get another treatment?
Well, I would leave it for 24 hours, so a day apart.
A day apart.
Because in between that you can work on another part of the body.
Okay.
But for something like this, I would do a day apart, probably do 4 or 5 sessions. And then because you've got so much area to work with, and then you might, the other thing about the shoulder is you go in quite deep into the shoulder joint. So there's muscles in there that the axilla's in there, the smaller muscles of the rotator cuff, serratus in there, which is a very important muscle for the shoulder blade. And you can get right into the deep muscles in the shoulder, which is very important. A lot of people don't realise. So you work the shoulder, front and back, but to do a proper job, you've got to go in quite deep and do your stretch techniques. Yeah, opening up.
What's happening below the shoulder?
So how's that?
That feels good. It's quite a relief.
Different.
Yeah.
Now what I usually would do would be a quite strong myofascial release beforehand, but for the purpose of this, next time I think when we do the hip and hamstring, I'll show some techniques, the hamstring, hip, and some release techniques, then the acupuncture. How does that sound?
That sounds great.
So why don't you sit up? All the needles are out. And swing around. So then we get the client to sit there and just relax in the sitting position first, rather than jump off the table, because we're not rushing this. This is something where it's you sit up, have a minute to sit up, get used to sitting upright, load of the head sits back on the shoulders, you're aware of the sitting posture, so the spine takes the load, and then you start to work the breath. It feels better, I can breathe a lot easier, but for purpose of demonstration, we sort of worked specific areas there. Yeah?
Yeah. And a straight spine, I think you said two things here. Sit here and relax and breathe.
Yep.
So the breath,
Yep.
just to come back.
Mm-hmm.
And also the spine, a straight spine, isn't it?
And the length.
The length.
So getting some length through the neck. A lot of people with chronic neck problems, you only have to teach them one technique, which is that length. And within a few days, a week, the neck pain might go from an 8 or a 7 or 8 down to a 2 or a 3, and they go, oh, it's much better, and they can move their head and turn their head. If I sit like that, I can only turn my neck to there, and this is a good demonstration. If I sit upright, I can almost go past 90 degrees. Same with the shoulder. If your shoulders are forward, you can only get your shoulder in a certain position. If you open the shoulder up, it clears the blockage in the shoulder joint and it can move. Spine, shoulder. So that's two things to think about. Is just that upright posture when you get a chance. On the phone talking to somebody, lengthen. You can still talk in a lengthened state rather than crouch down. It's also a habit we're changing. We're changing people's thoughts. Okay, I'm going to sit. It takes time.
And this is why I remember back we put post-it note, on the computer screen or laptop, and something such as sit straight or sit tall or get up and move, things like that. So we need to be, yes, we do need to be reminded, but if we can be aware, once we're aware, we will, as a habit, change of habit, we will start doing it and continue doing it, and introducing the movements and everything that we do to balance the movement.
Oh, the phone's ringing. I'll stand, I won't sit. I'm in a meeting. Oh, you can still have a talk in a meeting standing up.
Okay.
So you've got 15 people in a room all sitting down for half an hour. Why not stand up for 5 minutes? You have to talk. I can still talk standing up. I feel much better standing up than sitting down.
And I'm guessing that's why there's now in the corporate world a lot more stand-up meetings, because one, better on your body as you're saying, and two, they're usually done quicker because you're not sitting down and relaxing. So it increases productivity, and you're standing up. And also we see a lot more walk and talk. Instead of going and sitting down for coffee, you could just go and walk and talk.
Sure. Most offices are open plan, so you can go, okay, let's do one lap around the office and have a chat. While you're walking around, you say hi to a few people, you get to know people. What are you doing? I'm going for a walk. Come for a walk.
There you go.
Office walking.
So it could be actually for office work, meaning office talk, which is getting two things done at once, walking and doing business, but also the mindfulness, which is to spending time with someone.
Sure. And
just talking to someone as opposed to just being on their phone to find out what everyone else is doing. So mindfulness is also very important. So it's the physical, it's the internal, the spiritual.
Well, there might be someone they're having a bad day and they're on their computer and they don't look happy. So you might walk up and say, hey, Michelle, what's up? She might have come for a walk. Let's go for a stroll. Okay, so she gets out of that zone, you go for a walk, 2 minutes later she might sit back down. In that time you might do a stretch over there on the computer machine, or you might do a stretch over there, do a lunge, sit her up straight. You know, you might even get behind her and do a bit of release work on the neck. Find a spare chair, and I show this quite a bit in the office. Get the elbow and the shoulder for a minute. You can see straight away she's going, oh.
Release.
Release. Do the other side, let's walk back. Okay, I'll come back in an hour's time, let's do it again. Okay, so you're encouraging people to understand their bodies, but they're enjoying the experience, they feel a bit better, and they might think, I might go and see an osteopath, I might go and have some acupuncture. And they start to understand what it's all about. Little things like that.
So at the end of the day, what happens is that in the corporate world, if we do those little mindful things every day, because there's no magic pill, so what happens is that people will be healthier, will be happier, then there's less sick leave, and it's just a happier, healthier place.
Sure, and the people will actually won't mind coming to work. They'll think, oh great, I don't need a sickie on Monday. I don't need a sickie on a Friday. I might go to work. It's quite fun. Because I know Steve's going to give me a massage at about 10 o'clock. He's looking after me, and we're going to go for a walk and do some stretching. Yeah, this is okay.
Therapeutic. Anything else that we...
No.
So thanks, Steve. It was really interesting to be able to listen to what you're doing, the whys of what's happening in our body, and how to slowly, work on it step by step. And this is what Steve and I will try to do, is to go through, for example, today myself as an example, which is a good example, and then moving forward doing the different parts.
Sure, we can work, like I said, we work on the hip, we work on the lower back, the sacrum, the ITB, and we can do little techniques that will release that, but it also make everyone understand how important it is to have that worked on and released and looked after and nice and loose on a regular basis. Thanks, Chad.
Thank you, Steve. Until next time.
Tout à l'heure.